The focus on livelihoods and the environment. In 2022, she was listed as one of the top scientists in the world working in this domain. Welcome, Reena. Please join us. Yes. We also have with us today Mr. Sampath Kumar, Principal Secretary and Development Commissioner of the Government of Meghalaya. He is a distinguished administrator with extensive experience across sectors, including rural development, women's empowerment, natural resource management, early childhood education, among others. Mr. Kumar has also conceptualized the State Capability Enhancement Project, an innovative framework aimed at strengthening institutional capacity and improving service delivery. He is also an Edward Mason Fellow at the Harvard Kennedy School. Thank you for joining us, sir. Our next panelist is Ms. Aarti Ahuja. With a career spanning over 30 years in both the central government and state administration, Ms. Ahuja has led several key portfolios and has most recently retired as a Secretary of the Ministry of Labour and Employment. She has also held several other key portfolios such as Secretary in Handloom and Handicrafts, Women and Child Development, Health and Family Welfare and Tourism. A seasoned bureaucrat and governance expert, many of the systemic reforms she introduced in nutrition and health have been recognized as national best practices. She has also been part of the independent expert group of the Global Nutrition Report and a senior honorary research associate at the Global Institute of Health, University College London. Thank you for joining us, ma'am. Next up, our private sector representative, Deepthi Reddy, Chief of Women Empowerment at Reliance Foundation. Deepthi has previously served as the CEO of Samunnati Foundation and brings a wealth of experience across multiple social sector organizations, driving impact and sustainability. She is also the former head of investments and governance at Social Alpha, a Bangalore-based platform promoted by the Government of India and Tata Trust. Welcome, Deepthi. And finally, I'd like to welcome Professor Karthik Muralidharan to join us. Over to you, Veena.
Thank you so much and welcome to all of the esteemed panelists. I thought the way we would structure it is, if you notice, we have sort of two bureaucrats who, Karthik, I really like your metaphor of the car, so I'm going to use it throughout this panel. But I think we have two people who were the motor and the engine of the car, and then we have Reliance Foundation as a CSR, who I'd like to see as an external augmenter of state capacity. So I don't know if you're the tape that holds the parts of the cars together or the luggage carrier on top of the ambassador, but whichever that is. So I thought what we'd do is, I know that Sampath here has a presentation, so I thought we'd have each of the panelists reflect on state capacity from their independent perspectives, both reflecting on Karthik's presentation as well as their own expertise, and then we'd kind of go on to a set of questions and then open it up in a little bit to the audience as well. So Sampath, since you have a presentation, why don't you start?
Hello. Thank you. Yeah. So, good afternoon to all of you. Hello. Yeah. I think it's okay. Yeah. So, yeah, good afternoon to all of you. So, I think we had an amazing session by Professor Karthik Muralidharan. In fact, I'm listening to him for the second time. So every time I listen to him, actually, learn a lot. In fact, more things you get connected. So this is such a deep, that in fact we thank you for the Kriya to inviting me for this particular workshop. So I just wanted to show a few slides. Actually, this is an experiment we have been doing from 2019, in Meghalaya. So some of the things actually I would like to again. So some of the things actually I would like to again taking back from Professor Karthik what he says. We also got some good enough period to the tenure, what he's talking about, the stability, the government actually, which is the leadership, leadership got the second term. So it's like something like you can actually envision like an Odisha model. So it's something that, it's stability where, you can actually try things differently and do things differently. So the understanding of state capability challenges, basically we would like to just like put, some kind of a framework for all of us to, look at it. See, there is a low capability, there is a high capability. In terms of a low capability state, you would see in terms of the purpose, you would not see that low aspirations, unable to drive systemic reforms. Most of the time, the states are engaged in very day-to-day problems, and state organizations are generally passive, and simply implementing schemes but not solving the problems. They just like check the list, checking the box. Most of the time they do. And coming to the citizens and communities, we see them as the passive recipients and beneficiaries, and they're disconnected with the state. State is always different, disconnected with the citizen. While we are envisioning high capability state, what is the purpose of a high capability state? Is an aspirational vision, because state means people. People have an aspiration, how actually they really want it to. So that's something that it drives systems-wide reforms. When there is an aspirational vision, it drives systems-wide reforms. And in terms of the state organizations, they'll be more proactive from passivity to, they would actually be, I would say, a lot of, as I said, like, there's a decentralized action, and you can call them like, in case of Meghalaya, I was just looking at some other book also. It's how China escaped poverty. So where, it's a franchising bureaucracy model. So a lot of decentralization that has its own efficiency in terms of actually getting things done. So innovation, learning and adaptation to solve problems. In terms of the citizens communities, in fact, citizens are enabled to actively drive development, and they are deeply connected with the state. So this is a kind of a statement, like this is a kind of a framework with which actually we started working, and then we as a in fact this is a statement actually we had to say like exactly what Professor Karthik said. 15th Finance Commission, when they visited in 2019, they exactly said the same question. You are spending almost like a 50% of your state budget on staff, but what are the outcomes? What is the return on investment? So then we, in fact, our CM, Chief Minister, is a very innovative leader. What he thought, like, okay, let us, the main problem is silo approach. Let us actually bring a lot of collaboration. And he felt that, like, and he asked me, you take charge of all these departments. So this is something, it was scary, in fact, it really scared me. I took 2 months leave, earned leave. And then, thanks, there is a, I start reflecting with one IAS aspirant. She's now became IAS, Jai Sharada. So we started writing about, like, what things to be done to make it different. So then we came out with the State Capability Enhancement Project. So we thought, basically what is, we try to come up with, how basically what, there is a question like, what needs to be done. I like the framework again. What needs to be done for the state capability building and how it should be done. These two things is our, we wanted to make it a more practitioner oriented of, work. So we felt like, the biggest thing is that, as I said, like, 50% of the people are, employed by the people, because state employees are employed by the people, right? So why they are not, the return on investment, how actually we can bring the return on investment. One, in the government, this entire mechanisms of performance oriented, that monitoring, that, which doesn't work. It's very tough. Like, then again, they'll find ways and means of checking the box. So we felt the best way is that how can we actually build that public service motivation? How can we actually bring that intrinsic motivation? So where that can happen only if they can see their role more as leading the change. So we started investing a lot on one concept is we need to really build that local leadership for solving these complex problems while solving, in fact, leadership building while solving the problems. Not like, it's not by trainings. You make an effort and see that, like, how actually, you are changing rather than, giving a training on how to solve the maternal death, like, how actually you're making steps, So we started using one interesting framework. It's a problem-driven iterative adaptation approach where the state provides the holding environment where you can actually experiment and basically, and then you can make a progress. So we started using that, and then the second is like we really felt the citizen-state relationship is very important. One of the framework is that community participation. The state means state is not those who are governing, but state means those who are participating, who are actually the key stakeholders. So how to actually engage them. So we came out with a lot of ideas. I would like on how to every piece of work, including COVID management, we started looking at what is the community participation, how actually community would handle this particular problem. So then the addressing some systemic challenges, like the way I'm seeing the Kriya Center, understanding some of the gender issues, like systemic challenges, how to actually address those issues to, So then, of course, this is something, the fourth one. In fact, my colleague, Mr. Kumar, in fact, I really credit this work for him. He's one person actually as a district collector, so district deputy commissioner. What he did, he used the data to show that, like, how actually we can reduce maternal death. So we made it a scalable program at the state now. So using data and research. So another thing is a very important thing, research. We really felt that research has a tremendous potential. People are not using the research utilization concept. What we say, you have a research, but that is only in the academia, but like we're not using in the practice. So we started getting that ideas. And then the fifth one is a very, very important thing, and we very closely work on it. It's basically building political supportability continuously, because unless that is there, this work cannot progress. So how do you do that one? That's also, for another. It's basically these are three things, and we also, the mission economy, Mariano Mazzucato, we put it because she says state has the capacity. State has, state can do things. In fact, not only can do things, state can do transformative things. So state can only bring transformative things. Maybe if I say another statement, so because it is the people. So this is something that, this is where we started actually with some small wins. I want to tell you very interesting. Madam was there in the health ministry. Meghalaya used to lose 25 crores every year because our immunization rates were the lowest in the country. And so we started applying these principles of building that entire decentralized leadership and, bringing that collaboration between different departments, bringing the purpose before the implementation of the programs. So that led to, you could see that when we could able to, reach number 2 in the country very, very, very short time. In fact, that gave our chief minister, wow, okay, this is something like we can feel proud of it, let's actually invest more on this work. So we got more authorization to the small wins. So this is the way you build a political supportability. Then this is the work that I just mentioned. In fact, this is a 50%, now it's 53% reduction in the maternal deaths in the last 4 years. This has happened again, this entire approach, as I said, data driven. One, we track every high-risk pregnant mother data, and it's not like earlier we collect the data, now actually we're analyzing the data on a weekly basis. Okay, this on a weekly basis, when we started this exercise, every week 4 mothers used to die in the state. And almost like 56 weeks, you can understand how many mothers used to. So every week, and we used to understand that is the data. It's not data on administrative data alone. We used to actually collect a lot of this, the social and economic determinants of the data, like why they are dying. So very interesting data used to come. Like in fact, one of the things that has come up for maternal deaths, we found it's the gender burden in the state. That has come up for maternal deaths, we found it's the gender burden in the state, in a matrilineal society. So that's one of the major reasons, because women have taken a role that it's our responsibility to raise children, and without any birth spacing, they were actually giving birth after birth, and many mothers are dying because there is no birth spacing. That's why uterus was it's a lot of the challenges. So I'm just giving some example. Another important thing is there's a cross-sector collaboration, because that also we could able to do. Then, like I said, like women leadership, we thought okay, it's the cause of the deaths, one of the major cause of deaths is lack of that agency among the women, our understanding, their health. So we started actually bringing some kind of a lot of focus on women's leadership, especially creating women's economic collectives. Today, actually, 95% of our households are covered under self-help group network. We also have this village level bodies where the affirmative action was brought in. In alternate election, only women can contest in these elections. So this interesting policy that we brought before So then as I said, a lot of focus also was given demand side mobilization. While state is actually, providing services and, honing those services, streamlining those services, bringing the public service motivation is one side. But the other aspect was how actually we are, some examples of like, how to actually use, the entire women's, spaces like to really address some of these challenges that what we have, like whether it's a malnutrition or whether it is like, the maternal deaths. So in the process after 4 years, we felt like this work has to be institutionalized, and state has actually set up this government innovation lab and started actually proactively taking up other challenges too. So this is about, I mentioned about what and then this is the how actually the state capability work is done in this. There are 3 layers are important. Maybe you can see this for three important. One, you need to have authorizers. Authorizers, who can actually authorize, yes, this is a problem. We need to address this problem. Stunting is the problem. I need to address the stunting problem. Learning outcomes is the problem. I need to address the learning outcome problem. So that authorization is important. Without that authorization, you cannot mobilize the champions or teams. There are so many champions would be there within the system, but you need authorization. So getting that, state leadership, that's what building political supportability is important. And then the champions, like as I said, like Mr. Kumar, the collectors, there are champions, but they require, a lot of this authorization and, the kind of support that is required. And the third one is the work, a lot of, university, all students are there, like a lot of people are working with us in the Government Innovation Lab and also with Professor Karthik. So where you require facilitators, who actually understands, the development, who studies, in a much more, who actually can look at, so who can actually really help the both authorizers and champions to promote this work. So the final slides. So this is the kind of a practice of change. I just wanted to show you what I just said. So this is the kind of inputs, outputs, and outcomes if you look at the map. I love it. So this is something that, as I mentioned, like, once one of the identifying the complex problems, one of the things how it works is that actually you need to take some problems like maternal death reduction. It's very emotional, and also it connects with everybody, and it can actually address many other problems. So identifying some grand challenges, I would say, and then assembling teams and using this frameworks, and then ensuring that quick wins, and then simultaneously you can bring very, very systemic reforms. So there's like a lot of systemic reforms. In fact, so once you show the quick wins, you can show a lot of reforms. For example, one example I would say in health sector, what we are doing, we are actually, the entire financing is going to be changed, like what Professor Karthik has said. We are going to have outcome-based financing for health department from this year, because again, those kind of systemic reforms could be brought because we could show the results. Like, it's a very important thing. And the final thing, state capacity in action. One of the things I just wanted to say is that, like, on supply side, yes, rebuilding that connective tissue, we call it, like a Land Pitchett calls it, between citizen and state, and reinforce purpose and empathy and intrinsic motivation. But demand side, building that social capital is very, very important. As Professor Karthik also mentioned, that the citizens are not aware about their role. That's why actually most of the the government functionaries take the state for a ride, actually, honestly, most of the time, because if the citizens are aware of it, a lot of and we're also using a lot of science, brain science, behavioral science. That's a research, again, I'm talking about, to bringing this one. So this is a kind of a model that we have been working on. So that's So this is about kind of a partnership. Today we are going to have a partnership with Kriya too. Thank you.
I think the last bit is really important. We're really looking forward to the MOU between CREA FMR as well as the Government of Meghalaya. So thank you so much.
Yeah.
I did want to invite Aarti and Karthik back to the stage. Aarti, we've heard a lot from two men about lots of things that were going to help women. So I'm actually going to balance and have the two women actually reflect a little bit from their own very, very long experiences on both what both of the speakers have said.
Who do you want to
obviously-
go for? Would you like to go?
No, I think it's okay.
Okay, I wasn't expecting that. I thought I'll be speaking as a bureaucrat.
Yes,
Because
we do want you to speak as a bureaucrat first and then have a chance to reflect on what
while
others
in
have
the bureaucracy, I never felt like a woman. Ever. I was posted wherever. But coming back to the bureaucracy question first and the state capability, what do we even mean by state? It's not us. There are like 5,000 odd IAS officers in the country. Karthik mentioned about the size of the Indian bureaucracy as compared to other countries. Our foreign service officers are less than what Sweden has. So the state is the sanitation worker, it's the school teacher, it is the survey of India, all those are state. And when we look at the capability, if you were to parse it out and say, okay, the legislative part we do pretty well, the judiciary part we don't. We do the regulation part kind of okay, kind of non-okay. We do the administrative part kind of okay, kind of not okay. Our railways take all of Australia every day. They run on time. We conduct elections. We build highways. Maybe there are inefficiencies. Our PDS covers 80 crore people. Which country has something like that? So there are things that we do really well. And we are a young country of 75 years. So these are not bad achievements. But what has happened to capability are we have ourselves, you mentioned the term tied ourselves in knots. We have, over a period of time, we have certain wicked problems, which we are not able to solve. And the metaphor of the car is absolutely right. We started off, we are that generation. What happened? And this is my take, it's not concerned with what you said or you said, Sampath, is that we come from the society. The government is the society, working people, working citizens, working in different government jobs. First, I feel that we as a country have always had a scarcity mindset. We have this fear of failure. You see that in our education system, the extreme fear of failure. In the way our whole IT software industry has developed, it's only processes. Krishnan said, we are not into design, we are just assembly, right? The second thing is that because of this, there have been books written on that, we have got this jugaad mindset. It's good in certain things, but it's not good when we bypass systems. So when we are talking discretion at the cutting edge level, we need to balance that with a whole lot of other considerations. That is why the emphasis on processes, because we don't want that corruption to get engendered at that cutting edge level. But in spite of all that, it is still there. So the health, education, where the rubber hits the road is where we have, in a way, created these knots for ourselves. And an increasing knot that is coming up is the whole urbanization issue. The way cities are developing, the whole issue of people migrating, and since you raised the women issue, what's happening to women who are migrating alone? Who is even seeing all the missing women? Who's tracking them? What's happening to women who are not even entering the workforce because of the binding constraints on them? So you mentioned, when half the workforce is not able to be productive and join in fast tracking the growth, then that is a wicked problem. But that wicked problem comes not just from government policies, it also comes from a whole lot of other factors. And I'd like to, if there is time, very briefly give the example. Again, both of you talked about the mission mode. We do so well when we are in a mission mode. We get charged up and we do stuff and then we get an award, etc. It makes us very happy because that's the only way to show that we work, right? So the assumption I want to make here is that anybody. So in our country, we have about 1.4 million registered societies. I want to make the assumption, I firmly believe it, that anybody who is doing public service, whether you're doing research, whether you're running training programs, you run a center, you teach, you run an NGO, you head a trust, you are in the government directly, everybody is well-intentioned. Whoever enters that space is well-intentioned. They want to do good. And people are doing a lot of good. It's just that many things are not seen, many things are not heard or recognized. Given that presumption, given that people do want to do good, I was in the health ministry during COVID. And when we talk of mission mode, COVID was a very good example of how everything that we are talking about in a way converged. There was data, there was evidence-based decision making, there was research. When we started in our country, those sanitizer bottles have that thing you press. We were not manufacturing it. It was all imported. That started happening. PPEs, we were not manufacturing. That started happening. The ventilators were all imported. That started happening. Data was used. We had heat maps of, so this whole your COVID testing centralized in the control room. We could see where this is coming up. And then IIT Madras was helping us with that whole thing. So it was a collaboration across society. Whoever could be roped in, wanted to get roped in. There were states where the panchayats were empowered. They were given the powers of the district magistrates to take action. That was the kind of decision making at the cutting edge level that was happening. But that was a one-off. But it has shown us that if we want, we can do it. And I think that is a lesson. I think it's a very good lesson to all of us, because if we have to progress, which we are doing, but if we have to progress faster, then it has to be collaborative. It has to be more people coming together rather than creating those boundaries. And I think the ultimate thing is that we have to trust each other. The civil society has to understand that people in the government also do a lot of work. They are well-meaning. Government has to understand the whole lot of other people outside who are even more well-meaning, who even put a lot of other things at stake. I see a lot of people working in remote areas so diligently with no recognition. We need to be out there and facilitate that. And that is how I think that's where the future lies, not in any side thinking that, the other is less or other is less committed. That's my first take.
Deepthi, I was wondering whether you want to reflect, because you're sitting outside and you're also on one hand observing, on the other hand actually trying to augment. So how does that, how just reflect on what you've done at Reliance Foundation, but reflecting on what all of the other three, Karthik as an academic and the other two as bureaucrats, of course, have said.
Yeah, maybe reflection just as the tape is what I will give in on some of brief illustration. We did intensive work engaging with Rajasthan state government on child and maternity health. And interestingly, the first 48 hours of the entire process innovations that we could demonstrate enabled that the government took it over, and that has contributed to rolling it out further. So I just wanted to leave that as a good example of practically what it means as engaging in partnership. Thank you.
I'm not going to let you respond yet, Karthik, because I'm going to ask one question which I think is a hard question. You did put a sustainability person to moderate this panel, so I'm going to ask a sustainability question. So if you look at the framing of the way you framed your book, but I think we had a brief discussion outside with Sampath as well, and then the stuff that Aarti just talked about. When you're talking about services delivery, it's really about how do we, it's a relatively short to medium term thinking. Now, a lot of the problems that we have are because of feedbacks that might happen over the long run. So let me give an example of, if you give, as you said, free electricity to farmers, groundwater levels are going to come down. That's going to then make drinking water projects more expensive. If you give fertilizer and to farmers, that's going to increase nitrate pollution, which is going to increase stunting. But it's not the type that's actually going to be taken care of the programs that you talked about. So where does long-term thinking at all come in? And it's a question to all of you when we think about state capacity. Because when you think about service delivery, it's the today, the now, let's, mission mode, we achieve it. But then how do we not have unintentional, we live in a lot of these games are zero-sum games. But the implicit in the education healthcare examples are not zero-sum games. So I wanted to have each of you reflect on this long-term aspect, and then we'll open it out to questions.
So it's a very good question. Actually, the long-term thinking comes again. It depends on various factors. Actually, honestly, one. The government should be stable. So, because to move such kind of a thing, so essentially that's for political supportability, what we are saying. So, it's, for example, in Meghalaya, the state wanted to do the education reforms because we have education learning outcomes very bad, and we had to rationalize teachers and rationalize educational institutions. But it's taking time because, again, we are not really ready to do that. So one term was over. During the second term, a lot of thinking started. Now this time, we are actually showing the data now to the people. In fact, recently our chief minister made a presentation about what are the education sector problems. How actually, it's everyone thinks that education problem is teacher's salary. These are the only things that what Land Pritchard says that the donut. Like no one is actually looking at the center of the child is missing. So we started actually rising the debate. So it takes time for the long-term things, I would say, and it sometimes like very systemic things can happen, like gender reforms we could able to bring during the COVID time, because that's a time actually everyone doesn't have any, basically everyone actually looking for anything that will help local economy. So if you have more women's participation, I think it's good for them. So I think we need to, it also depends on the right moments of opportunity, and also this is what I would say. But one actually very if you communicate more with the communities, it's actually easier to bring any system-wide long-term things. The problem is that we don't communicate with the people. We communicate with the media, we communicate with, honestly, it's not like there is no communication between the communities, and, if we do that, it comes up. This is our experience.
So we are going in the same sequence. Yes, so just, I'm no longer in the government, so I'm going to zoom out and give that perspective. So the thing is, in the long run, we're all dead, like Keynes said. So where is the incentive to think of the long term, right? As a politician, as a bureaucrat, I want to show that I did this today. It's ascribable to me, right? I will do what is immediate. I don't want to do something with a long gestation period, which is, 10 years down the line, somebody will say, oh, I did it, and then I'll be squirming. I don't want to be doing that. That is the incentive built into the system for anybody. However, having said that, as Secretary in the Government of India, and this probably doesn't happen in the States, but in the Government of India, actively, there's a Vision 2047. Right? So sectoral groups of secretaries, we sit together, we actually sit together and we discuss where is it that we want this group, not my department or your ministry, where do we want our country to be in 2047 in this respect. And it's a collaborative exercise. So I would say as a country at the top level, this is happening and it's happening with all seriousness. The only issue is what we were talking about is the systems thinking approach. You know, we are currently, I don't think with the mega trends that are happening all over the world. Krishnan talked of AI, there's climate change, there's the whole demographic shift. With the mega trends happening in such a fast pace, I don't know if we as a country or even at the state level or even below that, whether we are adequately equipped in a way as to handle it and be ahead of the curve. So though we are planning for the next couple of years, there are events that may surpass us that we don't even know anything about.
I would maybe as a long-term standing in between for the past 10 years that Reliance Foundation has worked in, touching about 80 million lives and pan-India across geographies and so forth in different sectors, education, health, rural transformation and so forth, to the next 10 years of journey, corely focused on children, women, youth, clearly dimensionalizing the entire work as more partnership perspective for the future 10 years with the government machinery, the partner engagement and the community ecosystem. There have been early works of progress in different states that we have seen on this new paradigm shift that we have for ourselves looked at. Again, coming back, connecting to the growth versus development debate is where we are with outcome focus.
Is this on now? Yeah, I think it's on. Yeah, so thanks so much. Let me say, a couple of things on long term and then a couple of things on state capacity. On long term, you kind of alluded to saying that a lot of this state capacity service delivery is short term, right? Which is why my own thinking on state capability, has evolved from the time I started writing to when I finished, right? Because the traditional view is to say policy is fine, implementation is the problem, whereas state capability applies to policy making as well. And implicit in that is the long term, right? Because, so what I've done is, so on environment and sustainability, in fact, I say in the intro, I don't have a chapter on this per se, but it shows up implicitly in the public finance chapter, it shows up in the health chapter, it shows up because essentially what I'm saying is that when you take that 2x2 seriously with regard to thinking about your budgeting and policies, then a lot of this actually gets baked in. So the general equilibrium consequences of saying, so a lot of the book in fact then talks about how actions happen in one silo that then end up with negative effects in other silos, right? So, and I think at the center, there might be this committee of secretaries, but at the state level, there's often nothing like that, right? And so even if you just look at the jobs agenda, right? So the jobs agenda, actually nobody's responsible for it, right? If you think about it. So the finance department thinks about, can I afford a scheme? The tax department can be using GST data to have deep analytics on the economy, but they don't do that. They are just focused on their collections, right? Housing department should be thinking about how do I create more low-cost rental housing. But they think about their job as building low-cost housing on existing government patches of land, right? So just breaking the silos of government to say this is an all of government thing to look at these linkages is something that's needed and I talk about. The second thing with regard to kind of these pressures that Ateji was talking about, I couldn't agree more, and that's why chapter 17 then has this chapter on reimagining institutions, right? Which is in the end, in any kind of modern democracy or kind of well-functioning state, you do have institutions within government that are mandated with a longer-term focus that kind of provides certain checks and balances. So in the US, for example, you have a congressional budget office. That means you can't just announce schemes without some independent scoring of what this is going to truly cost, right? So part part of that is then saying what are the institutional investments we need to make. So think about it. So data, so in the 1950s, we built some of the world's best statistical systems. Our CAG is like world class. Our UPSC is world class, right? So you need institutions even to kind of build these elements of state capacity. So then the last thing I want to say, and wanted to pick up on what, what Sampath's talk was about, is I cannot emphasize enough the importance on what RTG was also saying, that this is a collective effort and that we have to decentralize a lot more. So the most powerful quote on decentralization, which I have from Ashwin Mahesh, who's this advocate of decentralization Bangalore, and he says the best way to solve our many problems is to increase the number of problem solvers. Okay, and so too much of our discourse still looks at Government of India and saying what are they doing, right? I mean, states in India are bigger than most countries. Okay, so we really need states to step up kind of both their thinking, their action, their planning, and like what you see in Meghalaya. See, the difficult thing about doing any reforms in India is we are so unique. If you bring an idea from somewhere else, people will say, "Arey, ye India mein kaam nahi karega." Okay. If you bring a new idea, they'll say, "Has it worked anywhere else?" Okay. So then you're kind of in this chicken and egg. Okay. So one way to solve that problem is to kind of de-risk experimentation by encouraging a lot more localized experiments, whether it's states or even districts. But this is then the challenge, going back to what I think was being alluded to earlier, is a lot of experiments happen but don't get documented, right? So an individual officer will come and do a bunch of things, and then he or she will move on. The next person has their pet project, right? So there is a lot of innovation that is not documented and studied, and that then becomes the role of the academy, these research partnerships, because the officers don't have the time to both do it and document it, right? So but if you partner, get the research, then the research and the documentation becomes an important ally for then the long-term distribution of some of these ideas. So yeah, so we can talk more, but I'm overall, I think,
no, but that's a really nice note on which to, because this is a research community and it's a call for many problem solvers but many documenters of that. And so I think we have time for 3 questions. What I'll do in the interest of time is to open it up and collect 3 questions and then have the panel respond. Is that okay? Yeah. So Soumya, and then, so we have Soumya. I'm sorry, I don't know, lady in the front.
Am I audible? Yes. So I'm a faculty, I teach economics at the business school here, and my question to the panel members is that in terms of state capabilities, international organizations have played a huge role in country like India, especially if you talk about WHO and UNFPA. Now, with all the restrictions and policy change happening in US, and what we hear every day that US is now not a member of WHO and putting a lot of restrictions on UNFPA, how do you see that will affect our state capacity in coming future, or do you think that there is no impact of that overall in the short or medium run? Thank you so much.
I think the lady and then Suresh after that.
Hi, I'm Yashita. I'm with the Gender and Digital Hub at Lee Directory University, which is one of the centers present here today. Want to take a moment for everyone in the room, and especially there are a lot of young students from all over the country, to acknowledge the work Sampath sir is doing, because Sampath sir and Sir, because you often, as a person born and brought up in Delhi, hear from a lot of my colleagues that I have to come to Delhi, I hate this city, but I can only find work here in the policy or research space primarily. So building those kind of local institutions is superbly fantastic, and having worked with the team, they're doing a great job. My question comes from my line of work. In today's day and age, everybody's thinking that digital technology, AI will solve everyone's problems. And I am grappling with this personal thought, which is I interact with frontline workers on the ground who are given 20 apps to work with, thinking that digital will solve their problems, which is not the case. And at the same time, their only feedback is, give us more data entry operators, give us more support. Where is the money going to come from? How do we tackle these complexities? As you rightly mentioned, state is not about a bureaucrat, it's about the person on the ground. And the long-term vision, how does it address the money? So where does it come from?
I think there's one. That's the last. We take this question and then open it up.
Hi, I'm Madhvi, and I primarily work on ECD interventions, but I also do a lot of basic work in terms of trying to understand cognitive processes and all of that, because I'm also a developmental psychologist and a cognitive science person, but have really appreciated the translational work in terms of trying to look into ECD interventions when I was in Haryana as well as in Telangana and recently in Andhra as well. Some of the very small scale studies that we have done and looked into in trying to address some of the issues like school readiness and the kind of some of those infant indicators or also of the first 1,000 days of life and all of that. But the key thing that we are always targeting to really see is the SDGs are kind of ballparks for us to really say, oh, we need to achieve some of these SDGs in terms of maternal and child health, in terms of gender equality, in terms of all of the other SDGs that are enlisted and all of that. But how does the government actually look into in terms of addressing that these are SDGs versus the kind of our own national level issues and targets that we have, because we know when we are on field, we know there are practical constraints to be able to achieve some of this, and how do we address some of these issues in terms of looking into these practical issues. Thank you.
Do you want to start?
Maybe. Meghalaya, yeah. So, the last question, I think, how do you address the national goals versus the state-specific goals? Very
SDGs.
International versus national. Because so we, in fact, this is a very good question. In fact, this is something that some priorities would change. Basically, again, checking the box. SDG has become a checking the box kind of a thing. If you look at the lot of aspirational districts data, so a district which is actually coming on top suddenly goes down, like, it's like a lot of variation. It's not like not constant, as the data has been shown, like one of the slides of Professor Karthik. The data accuracy is a major issue. Especially when we talk about, when we measure the data, these challenges are there. That's why we should actually talk about more about the outcomes. So for us, like, at least in Meghalaya, we see only the mother. Every mother, like, if from there, ECD comes, from there everything comes, like adolescence would come. So I think that kind of a life cycle approach, like maybe keeping that mother at the center or the child at the center, that requires, the state can do. It's a state leadership. If state follows, in fact, it was also discussed at the national level. In fact, even our Honorable Prime Minister also said, like, indicators can be state specific. It need not be as, written by, like, as SDG. So I think it's a call, actually. People should understand. I think once, like, political leadership understands it, they can drive this one.
Thank you.
The answer, very quick answer, because I think it's not fair for me to answer, but the point on money actually doesn't take much money, point number one. And we always look at ROI on infrastructure. We don't look at the ROI on development sector. ROI on development sector is incredibly high. Like what Professor Karthik already actually said, that little bit of investment, that little bit of money, definitely the state and be the union of all the countries, we have that money. There is not a problem in terms of that bringing the efficiencies. It's two things: only prioritization and not actually looking at if you want to satisfy the existing folks or you want to go attack the purpose. Purpose is what we are here for. If you're looking at improving nutrition, then you have to solve the purpose problem, not the, okay, how do we make Anganwadi workers happy? That's not the thing. You have to see that, okay, the purpose is the key. When you do that, in fact, in health, for the same data issue, when we had this thing, so we called the A&M unions. We asked them, what do you want? Do you want an extra person or you want some funds? They said, you give the funds, we will hire whoever you want to hire. We gave the money to the concerned facility to decentralize. Some of them wanted to hire their own son, cousin, nephew, someone they want to do the work, and fine. And actually, you will see a huge improvement in our all this data exercise and impact effect also. So that's.
Okay. Karthik, would you like to answer
Answer whatever you want, and then I'll.
Okay. Yeah, so we let Karthik have the final word. So on the WHO and UNFPA issue, first of all, we don't really know how much of cut is going to happen. So it will be a little premature to answer. But having said that, what WHO and the other UN organizations do in India is basically technical support. It's not so much, we don't depend on aid It's a very 0.101% or something of our total outlay. So we're not dependent on aid as such. What these organizations do is actually provide the expertise, the technical expertise and the cross-cutting issues that we need not then invest in. So to that extent, I'm not sure how much of their role is going to get truncated because of that. So that's first. On the SDGs, I'd like to say that, what SDGs and similar parameters or indicators, what they do is provide a framework. What is important to understand is that when it's a global macro framework, our country gets judged against other countries based on that framework. When you look at it, it's all about the individual. It is that person, their education, their health, their lives, whatever, their climate change. It's about that person. And that is the key eventually, whether we are talking national, state or local, that is the key. If we don't think of that person as woman, as maternal, as farmer, as PDS beneficiary, but think of that as this one person who is a myriad other things. And how do we prioritize and how do we reach that person? And the answer, I think, to all of us is so obvious. You need more problem solvers. You need collaboration. You need people on the ground to be there to do this, right? So I hope that answers kind of the question.
Yeah, maybe to Aarti's response, asserting back again to the collaboration piece, Yashita. Certainly, the current happening of things that you see, we also have been global anchor partner. And clearly, I think money has nothing to do with the problem solution approach that we have. We are going ahead. So therefore, I think it's about how the partner engagement with understanding the ecosystem matters. That's all I would add to.
So two quick things. I think on the US kind of withdrawal from WHO and stuff, I think in a way it can be an opportunity for India because it also gives, at some level we are at this stage where we should be investing in creating our own frameworks and kind of being a leader for the global south. In some ways, what we create in India is often more relevant for countries that are, say, in Africa relative to what might come, even from the US. So I'm not too worried about that. I think certainly in certain aspects of global public goods, pandemic prevention, coordination, the WHO matters, but I suspect that things will some of this is just symbolic and it'll be fine. I think Yashika's point is a very important one, and I want to use that as a chance to kind of really push, not push back, but caution against what I see is too much kind of techno evangelism, like of saying, oh, AI is going to solve it, oh, technology is going to solve it. The thing is, at the end of the day, every one of these wicked problems are human intermediated, right? So the technology can improve the productivity of the human, but can never kind of by itself solve the problem. And again, I'm basing this on data and evidence, where we've done multiple RCTs on EdTech, right? So even this incredibly effective MindSpark software that we studied that worked in Delhi, worked in Rajasthan, in Tamil Nadu during COVID, we did an RCT where we provided tablets to households with the software, but the effect was zero, and that's because it didn't have the adult engagement to make sure the child was spending the time on task, okay? So the technology is not going to replace the human, it has to be integrated, and that is, I think, a very important caveat for tech projects, because unfortunately, I've seen in many cases where, and this is true even in things like Poshan, which is this national initiative to kind of digitize data on ECD. But the number of states we've gone to where the poor Anganwadi worker is expected to still maintain the paper records, okay? So if you then go use a time use analysis on the front, it's actually increasing the workload rather than kind of streamlining it, right? So I think the biggest problem for technology in government today, frankly, is that we don't have what are called in the private sector product managers, okay? That say, how do you reimagine a work workflow once you have the technology. Okay, so the way technology happens in government is there is procurement, and that procurement is for a system, and then often the same offline process will be moved online as opposed to redoing the process itself, because the person who does the procurement is often not there in time to kind of envisage the usage. So we really need, effectively coming back to more problem solvers, right? Even the IT secretaries in most states see themselves as essentially doing the procurement rules for IT projects rather than functioning as CTOs to say, like, how do you use technology to improve every government process and bring that product thinking as opposed to just kind of the procurement rules. And I think that's very low-hanging fruit, where again there might be scope for collaboration between institutes that understand technology product design, and then because again the government person is typically approaching this from a compliance perspective. So their biggest concern is tomorrow no issue should be raised about my procurement process for this system, as opposed to how did that change the workflow and improve productivity. And so I think that's a very important area where a lot of progress can be made.
Going to ask people to say their 10-second version of just one thing of how do you rebuild or re-engineer the car while it's in motion. I'm just going back to your analogy. I don't know, maybe we start the other way, Karthik, you start.
No, I think, see, because we do things well in mission mode, okay, I think it may help to even just articulate a vision for a state capacity mission, okay, where we say, and sort of, and what Sampath said was very important, and this is why the book is big, right, because there is a component of state capacity that's about systems, but you don't get capacity till you motivate it by solving problems, right? So what he was doing, it was the problem way, right, because that's what catches the attention, saying, I have to bring maternal mortality down, I have to do this down. So I think there is, but the core components of saying building an effective data analytics unit or building an effective public finance, it's not rocket science, right? I mean, so in a 5-year vision, I think states can actually do this. And again, I think Sampath and what they've done can be a template even for other, for other states. And my hope is just that even a few states that do this will then set the template. So,
Deepti, you want to 10-second?
Maybe just articulate on the design piece along with alignment. In every strategy that is rolled out to the ground, again with the focus on the beneficiaries, outcome focused.
Yeah, so basically I think we have not done systems thinking so far. We need to really start doing that on a very serious note, and once we start doing that, many things will, maybe not all, but many things will fall in place. Just that 10 seconds.
I love systems thinking.
So, no, I just wanted to say, again, I think there is a tremendous, opportunities there within the state. I think there is especially as the researchers and everyone, a role for everybody. There's tremendous opportunities there. We think that it's very difficult to work with the government. In fact, it's like a joy to work with the government. only thing is that you just have to you start as I said, like if you get a right, just you need to fix that system, then it will be auto-catalytic process. For us actually now, it's like every day something new happens because it's a auto-catalytic, because inspiration inspires something, so it's like, as you said, like more problem solvers. Thank you.
Thank you very much.